So today I will be breaking down the axillary region with you people. First of all, from axilla, what you have to do for SCQ, MCQs, and everything that I am going to show is marking of this topic. From introduction, you have to do the definition. Axilla, what is axilla? It is space between the upper arm and chest wall, just the definition. After that, you should know the boundaries of the axilla: apex, base, forewall, anterior, posterior, median, and lateral. I will send you my notes of this topic so you can relate with them. And I will recommend you preferably to read my notes because it will help you to summarize stuff. Next, go boundaries, apex, vico, axillary canal. If you imagine what axilla actually is, it starts like this. Look, this is the apex or the axillary canal from which all of your nerves or veins related to the axillary region enter. So it is like the inlet and the outlet of this region. And next we have the media, it's anterior, posterior, medial. All of these relations are important. What is anterior, what is posterior, and what is medial, and what is lateral. This is of importance. And then you have to do the base or floor. This is also important. They will give you question like write a note on the axilla along with its boundaries, and then you will draw this, and I will share you in the group my notes so you can help them, so you can take help from them. Anterior wall, posterior wall, medial wall, and lateral wall. It all goes, and I will send you a voice note of it so you can know which thing comes anterior, how it comes posterior. I will clear it in a voice note. Next are the contents of the axilla. Axillary contents are very important, especially for viva. Like in many colleges, they ask what are contents of axilla. So these are the contents of axilla. You have to do their names. Layout are not important. You can skip the layouts. You don't have to waste your time on it. Just skip it. Next is a very important question, and it goes like this: axillary lymph node and axillary artery both are of unique importance. You have to draw the diagram of the axillary artery, and I will also give you a voice note explanation of the axillary artery, how it originates. I do have a YouTube video, but it is actually in the Urdu language, so but you can also consult a chart from there. Next are the relation of the axillary artery: first part, second part, third part, and fourth part. Relation of axillary artery are it was asked once in a past paper, so I would recommend you to, yes, you have to do the relation of axillary artery. Look, there is no concept of the relation of the axillary artery. It is like cramming or memorizing, so you have to do it with mnemonics. I will share you the mnemonics in the group, and then you can do from there. And next we have here the relations continuing, and other are the branches of the axillary artery. You have to do the names of the branches. Axillary artery gives 6 branches. One branch arises from the first part, two branch from the second part, and third branch from the third part. Superior thoracic artery, thoracoacromial artery, lateral thoracic artery. ठीक है. Superior thoracic artery is the first part of axillary artery. It comes from the first part of axillary artery, small branch. You have to do this text that I tell you. Superior thoracic artery is a very small branch. It arises from the first part of the axillary artery. Enough. Thoracoacromial artery is the branch of the second part of axillary artery, and it pierces the clavipectoral fascia. This is the MCQs, as well as I told you in the clavipectoral fascia lecture. If you don't have my lecture of clavipectoral fascia, you were not present in a Zoom session, I will recall it when I will tell you. Next is pectoral branch, deltoid branch, acromial, clavicular branch. These are the branches of the second part of the axillary second part of the axillary artery की branch से आगे branch है. Thoracoacromial artery is the branch of the second part of the axillary artery, and further branches of the thoracoacromial artery are 4: pectoral, deltoid, acromial, clavicular. Just do the names of these branches. Don't do the detail. It is useless to do detail. Next is the lateral thoracic artery. Lateral thoracic artery is a artery, the second part of the axillary artery, because second part of the axillary artery give 2 branches. One is the thoracoacromial artery, and then the lateral thoracic artery. The thoracoacromial artery further give 4 branches: 1, 2, 3, 4. You have to do the names, and you have to, for lateral thoracic artery, you have to do that second part of the axillary artery. Branch of second part of the axillary artery, and in female the artery is large and give off lateral memory branch to breast. This is the MCQs. Next is the suprascapular artery. Suprascapular artery is the largest branch of the axillary artery. This is very important, and it terminates near the inferior angular scapula. It gives a large branch called circumflex scapular artery. This is important. This is the text that you have to do. And another branch of the third part of axillary artery is anterior circumflex humeral artery, and then it is a posterior circumflex humeral artery. Anterior circumflex humeral artery is small branch rising from third part of the axillary artery, lower border of the subscapularis. This is, information is enough. Even if you want to skip the lower border subscapularis, you can skip this line. Posterior circumflex humeral artery. This posterior circumflex humeral artery is also a branch of third part of axillary artery, because first part of the axillary artery give one branch, second part of the axillary artery give two branch, and the third part of the axillary artery further gives three branches, 1, 2 and 3. Third part of axillary arteries, the branches arising from third part of axillary arteries are these three. The posterior circumflex humeral artery. The posterior circumflex humeral artery is actually a content of the intermuscular space. You can write it. You can write what I tell you. The posterior circumflex humeral artery is a content of the intermuscular space. It is actually at the quadrangular intermuscular space. It passes through the upper quadrangular intermuscular space. This is a line that you have to do, and it anastomosis to the ascending branch of profunda brachii artery. This is also MCQs. Next is axillary vein. For axillary vein, I will also share my notes with you, and I will also give you a voice note of it. This is actually important more for Viva and less for a SCQ, but you should know it. Next are your clinical boxes along with this. You have to do the clinical from the combined PDF that I share you in the group. This PDF will be alright. Axillary lymph node. I will share again. I will share my notes with you and a voice note explanation if you want. This lymph node you have to do it in a group: anterior group, posterior group, lateral group, central group, apical, infraclavicular group. These are the sites where lymph is drained and where the lymph is filtered, and it is then moved and circulated around the body. You have to do this diagram too for axillary lymph node if it comes in a paper. And the clinical box, again you can read the clinical box from here, but to memorize the clinicals you have to do it from the combined PDF. Brachioplexus is a very important question. Now what to do, and in the brachioplexus you have to do you should know what is a brachioplexus. It is actually a collection of nerve or roots present in your cervical region. It extends from your cervical region to backward, right, and then it is present near the neck cervical region. It consists of root, trunks, division and cords and branches of the nerves. Look, now the nerves which are present as a whole, they give rise to many branches, and you have to do them. So first of all you have to know what is brachioplexus. Spinal nerve C5 to C8 in T1, anterior primary rami. Look, this is very important. What is the anterior and the posterior primary rami? A nerve divides into two ramus: primary ramus, anterior primary ramus and posterior primary ramus. So it is the anterior primary ramus here. Next you have to know the concept of prefixed and postfixed. What is the prefixed brachioplexus? What is the postfixed brachioplexus? Roots. After the roots you will go to the roots and trunk supraclavicular part, and then the division of the trunk retroclavicular part, cord and branches infraclavicular part. If you are doing the root and trunk of supraclavicular artery, you don't have to like memorize it word by word or all of it. No, the best way to do is to memorize this diagram. This diagram clears each and every aspect of the text. Prefer to do the diagram, not a textual work, okay? And for diagram I will recommend you a YouTube lecture. For the diagram, a YouTube video. When you do the diagram you will know this area is the roots, then these are the roots, these are the trunk, these are division, and these are the cords. Root, trunk, division, cords. It goes like this: ready to drink cold beer. Roots, trunk, division, cord and branches. Okay, you should know the roots, and they're all mnemonics. I will share with you in a voice note. For brachioplexus you have to do the diagram will ultimately come in your prof paper because it is of highly important. And then you should know the concept of other things too, like if you can draw a diagram of roots, but you should know which nerves are involved in a root: C5, C6, C7, C8, T1. These are the nerve roots which are involved. And then their branches. What are the branches which are involved? Like these are the long thoracic nerve involved, and what muscle it innervates. Long thoracic nerve innervates, that is anterior muscle. So you should, what information you should know about the nerves involved in the brachioplexus? You should know their root value and the branches, root value, branches and the muscle they innervate. I will give you my notes as well as some kind of short overview to this topic in the voice audio. After that you have the sympathetic innervation of the brachioplexus. This is not very important. Sympathetic innervation, you can just read it or skip it. The main question that will be asked is the branches of the root, branches of the trunk, right, branches of the cord. Then we proceed to the next. Branches of the posterior cord, I will tell you all it in the morning. Blood supply of brachioplasty, yes, you have to do the blood supply of brachioplasty. This is important. Blood supply of brachioplasty, special letter feature M. You have to read it for MCQs. Give it a read for MCQs. Next, the clinicals. If they will not ask you brachioplasties, they will ask you the clinicals of brachioplasties. All clinicals are of highly utmost importance. You have to do them from the combined PDF that I sent you in the group. Horner syndrome is also important. So this was your chapter axillary region and brachioplasties.